I was warned on Monday because of the seriousness of Fiona's condition that Medivac was a possibility. So on Tuesday, I'm not quite sure precisely when the decision was made, but I would say it was probably quite early on Tuesday that they felt that although Fiona's condition was stable and she'd been put on a ventilator and everything, she needed specialist care. I met Dr. Anrit, who is the emergency medical doctor on the helicopter who arrived that afternoon to assess her. And there was one concern that perhaps she was too ill, but I think bluntly I was told fairly clearly that if that was the case, then she probably would have died. So the decision to Medivac her, which I obviously signed something, was quite an easy decision at the end of the day.
We need to talk with the treating team, with the helpful. I would like to thankful to the Bangkok Samui Hospital as well that they plan a very good plan with us. They do the catoscopy, stop the bleeding, do the hemodialysis to make the proper condition, and we put the intubation together. The first thing we need to monitor the vital sign, the blood pressure and the heart rate, because the patient still have the breathing. So we need to make sure that the patient is not shocked during the flight. The second thing is we need to monitor the ECG with the many reasons, but one of the important thing for this case is patient have acute renal failure that might have the hyperkalemia as well. So we need to monitor that they have the sign of the hyperkalemia or not.
She was transferred from outside hospital because of the severe infection of the right arm. At that time, it's already complicated by multi-organ failure. She has sepsis, she has bleeding in the brain, subarachnoid hemorrhage, has a blood clot in the large vein of the brain, the sagittal sinus thrombosis, has seizure, has renal failure that has to be on hemodialysis. And she's unconscious at that time. She doesn't know what's going on at that time. After discuss with her husband, we're giving her 10% chance that she might make it. But in that 10%, we cannot guarantee how much quality of life she can be back to her normal. So her condition involves multiple specialty and subspecialties. She has renal failure that needs hemodialysis. In the term of neuro condition, she has seizures multiple times. She has to be on the medication to prevent seizure, monitor the seizure activities, and also the blood thinner for the thrombosis or blood clot in the brain. First of all, we have to stabilize her, make sure that she has no more seizures activities, take care of her brain, that she has a bleeding, and the most important is we have to get rid of the source of the infection that caused her all this complicated condition. So after she was stabilized in the ICU, we took her to the operating room to do the debridement, and also the antibiotics has to be started early. Nephrologist has to involve with the kidney failure that she has to be dialyzed, get rid of the waste product that she has. Infectious disease specialist to adjust the antibiotics to a proper antibiotics. Also the vascular point of view and the wound care has to get rid of the source of the infection. From the imaging study, she has very severe infection of the right arm. Look like she has to lose all the skin from her right arm. But with our evaluation, actually she has a focus of the infection in one part of the arm. We did the debridement focally, and the rest of the arm we explore with small incision, which it showed that she doesn't have that severe infection as from the CAT scan. So we keep the skin of the rest of the arm and monitor it closely and take her back for the second look. We're pretty pleased that we don't have to take the whole skin from her arm out. So as a result, the patient doesn't have to lose the skin of the whole arm, just some segment that have severe infection, and which we can reconstruct after the wound get better with the skin graft, and it look more pleasing cosmetically, which make the husband and also the patient is very happy for the result. The challenge for this condition is she presented with very complicated condition. She has sepsis, the infection in her bloodstream, stroke, renal failure, and also very severe infection that she might lose the whole skin and of the arm, or maybe more than that if we cannot control the infection. since infectious and vascular conditions do not involve only just one single organ. Therefore, multidisciplinary team plays a major role to achieve the best possible outcome.
What I will say, it is life-changing because it makes you realise, it just makes you realise that when you go home every night, the only thing that matters is being with the people you love. It makes you value your life a lot, and I can't thank, I thank everybody here from the bottom of my heart for giving me another go at it. Thank you very much.
Because of the nature of her severity of illness, we have met a lot of experts, specialists at Bangkok Hospital in Bangkok, and I cannot fault any of them. They are clearly extremely knowledgeable about their professional aspects of their medicine. Can't say better than that.
Fabulous hospital. Thank you all very much.